Earlier today, I talked about one of my colleagues had a post yesterday in the past few days about spine surgery and old-fashioned versus new technology. And I wanted to give some context to that because I was there when the old technology was used. I was a resident back in the 80s, 1980. And I think 1983 or 1984, my professor, Dr. Edward H. Simmons, returned from a conference in Europe, in Germany, and said, we have to start putting in pedicle screws. And we didn't know what they were. And so what we did was we took Zilke instrumentation, screws that were used in the front of the spine to use for deformity, and then put them in the back of the spine. These were all times no FDA approval. This is just what we're doing. It was almost like the Wild West. We attempted to do that over a few cases, and probably on our fourth case, we were able to get 4 screws in. Now, the technology, you had to make a big incision and then go down to the spine to find where you were, and then put a metal clamp on the vertebra you thought you were at, and then you'd say, okay, I'm at the right level. If not, you had to make the incision bigger. And so we had basic x-rays, and a front, back, or an AP view, and a lateral view, a side view. So you'd have to take 2 views, and you'd take an x-ray, a portable x-ray, you'd have to cover the patient with sheets, sterile sheets, take an x-ray, then do the side x-ray, and then they'd have to run an x-ray department, or if there was a developer in the operating room, and then come back and hang the x-ray to make sure, just to see where you were. That burned up a lot of time, burned up a lot of blood loss. That was the technology at the time. So, it took us, when we finally got our first level, like L4, L5, we put 4 screws in, it took us almost 8 hours. The patient lost 6 units of blood. Those patients, by and large, if they were chosen to be the right patients that had horrible pain, had documented disability, couldn't work for 6 months or a year, were taking 5, 6, 7 Lortabs a day, those patients had surgery, they did very well. A lot of patients that didn't do well, perhaps maybe they shouldn't have had surgery, that kind of surgery at the time. And I maintain that more good was done than harm.